Hi, and welcome to Hiss and Tell, a cat behavior and more podcast, hosted by me, Christina Wilson, animal behaviorist. Today I'm speaking once again with the world's best veterinarian, Dr. Gina Rendon of Williamsburg Vets, all about feline anxiety and stress. What do cats really have to be stressed about? Do they need anti-anxiety medications? What are some strategies that we can use to help our cats be less stressed and depressed? All of this and more. Starting right now. Hi, and welcome to another episode of Hiss and Tell. I am your host, Christina Wilson, and with me today, again, is our wonderful friend, Dr. Gina Rendon, the medical director of Williamsburg Vets. Hi, Gina. How are you?
Hey, thanks for having me.
Thanks for being on here yet again.
Yes, always a pleasure.
So today, I don't know what that was. I'm so sorry. I'm out of my mind. Today we're going to be talking about stress, depression, and anxiety in our cat friends. So I guess off the bat, what are some common signs of stress, depression, or anxiety that you see in your practice?
So the signs that we see with depression or anxiety with cats, one of the things that's tricky about them is that they can also be signs of disease.
Mm-hmm.
And so things like sleeping more, eating less, vocalizing more or vocalizing less if it's a cat that tended to be chatty to begin with, under grooming, over grooming, avoiding socialization, those types of things. Sometimes you can tell by body language. Not everybody is great at reading cat body language, but the position of the tail, the way cats are sleeping, if it looks like they're more curled up than they usually are, they're not on their backs, and, you get to see the lovely belly of a relaxed cat. Sometimes you won't see that if they're depressed. So those are the main things that you see. And like I said, it's that often overlaps with health issues. And
Mm-hmm.
So what we always recommend is if there's a change in any kind of behavior to bring them in so that we can make sure that it's not something else. And to go back to that too, with medical issues can also cause depression or anxiety.
Right.
If they have chronic pain or if they have GI upset, if something is just off, then that can also cause depression. So just making sure that those underlying issues are addressed and then addressing any kind of anxiety or depression that goes with that.
So how do you differentiate then between something that is a behavioral issue or something that could be a medical issue?
So the physical exam, obviously,
Mm-hmm.
The history, and then doing lab work. So which for cats is so important because you can have a cat that looks perfectly healthy, and then you may end up doing blood work or urinalysis, and you find things that you don't expect to see. But, a good physical exam, making sure that there's no pain on palpation, that, the abdomen feels soft and comfortable. And, the major markers for kitty cats, just checking their kidney values, their liver values and thyroid, all of that, just making sure that all that's normal. If everything comes back normal and, for the most part, the physical exam is normal, then you have to start questioning, like, what's going on at home? What's going on in the environment? And if it seems like there have been things that are going on, everything else is normal, then considering those behavioral changes as depression or anxiety makes more sense.
So could anxiety or stress in cats lead to physical health problems?
Absolutely. Yeah,
Mm-hmm.
for sure. And so that's actually a really common thing. The most common things that we see are urinary issues.
Mm-hmm.
And so I think a lot of people are familiar with fluted, the feline lower urinary diseases that cats will get. And a lot of people think that those are associated with urinary tract infections. And sometimes they are, but more often than not, it's just inflammation. And so anytime we see a cat, especially like a young male cat that's having urinary issues, one of my first questions is, what's changed in the environment? Did you go on vacation? Is somebody visiting? Is there construction going on? What's happening that's, potentially stressing this cat out? So urinary issues are big, GI issues. They can have dermatological issues, so a lot of like rashes and scratching and overitching. And I'd like to say that more often than not, that's allergies,
Right.
But it can also present as anxiety. So cats are very sensitive. If something is off, then they can very easily make themselves sick.
Isn't there like a pattern where it's more likely to be stress and then another pattern where it's more like to be allergies? Or is that like a myth?
Yeah.
Okay.
Yeah, that's a myth. Yeah.
Okay.
just over grooming. And cats can over groom for other reasons than allergies or anxiety. So GI issues. I think
Right.
some people recognize that, like if they have chronic pancreatitis, they may be over grooming their abdomen because they're painful. But you also see over grooming of the abdomen with stress and with allergies. And so you can't just look at that distribution of skin issues and be able to diagnose. You have to do testing.
Okay, that's fair.
Yeah.
I'm sure you don't remember this, but remember when Steve got his tail broken because Allie accidentally shut it in the bathroom door, and then he had a cast on his tail, and so his tail was like a little bit of fur, and then they had shaved his tail, obviously for the cast, and then there's a little bit of fur at the end, and a bunch of the white cats, like Uncle Dad and Pam and Bev, groomed their tails so that their tails matched that pattern.
There you go.
Like, it was like, they're like, oh, we're doing
They had
something
to be the
new.
cool kid.
Yeah, they were like,
right.
we're doing something new with our tails. Okay, and they all groomed their tails
That's
so that they looked like
hilarious.
Steve's. And we were like, oh my God, the tail trends.
Nuts.
Yeah,
Love
so
it.
crazy. I just thought that was the funniest thing. I was like, he is really setting trends where everybody else is like, all right, I guess we're doing this. This is what our tails look like now.
This is in. This is in.
So cats are sort of in a way paying attention to fashion, like
Your cats. I think your cats.
our cats. Okay,
Yeah, your cats.
Our cats, and only with Steve. I think I don't.
And only,
I've never seen them do that.
No
when, like,
other
Mimi had her,
trendsetters.
her like leg shaved or anything. But it was so funny. Where I was just like, "Are you serious?
What is
like
happening?
you're really doing this?" Okay, it was so weird. Anyway. That will just always stick in my brain is like what a bunch of stone cold weirdos.
Though.
Yeah, right? Yeah. So what do you find to be the most common triggers for stress or anxiety in cats?
Changes. So cats love predictability. And so things like, and it can be really, it seems like nothing to you. It can be something as simple as you've moved the furniture around.
Yeah.
And cats may hate that. Not every cat, and I don't want to be too general because obviously there's a lot of individuality, but it can be something like that. It's really common when humans go on vacation, and even if there's somebody who's there who's known and loved, there's just that change, and those companions aren't there anymore, and so that can be really stressful. Moving obviously is really stressful. Any kind of construction, either inside or outside of the house, so noises that have changed, things like that. Sometimes you don't even really know. Cats can be very sensitive, and so I've read reports of things like plumbing issues that humans don't detect, but there's some sound that's happening, and for whatever reason, the cat is freaking out, and there's a lot of anxiety, and then somehow they realize, oh, it was this thing that we didn't detect, but the cat detected it. So it can be really subtle, and you don't always find out, but, following those behaviors and looking for any changes in behavior can give you a clue.
Yeah, I'm a big proponent of collecting data. Collecting data is so important so that if something changes, that there's an issue.
I actually encourage people even for single cat households, especially as they're getting older, to monitor their weight. Because that's also something that's really subtle, so you can just take the weight at home, and if you see changes, this is true, when we bring them in, if they're in the office and we see that there's been a weight change from 1 year to the next, or from, several months to the next, that is often indicator that something's going on.
Absolutely. And I just want to add to that list of common triggers, the addition or subtraction of a cat into the house, right?
Or any animal.
Yes. We saw that in our house when Steve passed, and then when Mimi passed, everyone was very upset, and then got even more upset, and that caused a lot of stress and anxiety, and several cats became very aggressive, which is a sign also of depression and anxiety and stress. So it doesn't have to be that they just get depressed in the way that we view depression. They can become really aggressive with each other.
Yeah,
that's an excellent point. Sometimes with people as well. So because they just can't. They're not being able to regulate their emotions in the same way. So by that same token, often I get a lot of cases of intercat aggression because there's now like a feral cat outside or somebody else walking around the house, and that's stressing the cats out. So that's another big stressor. And the other common trigger that I thought about for stress and anxiety is boredom. A lot of cats do not have enough to do. They don't have enough environmental and intellectual stimulation. And if they get too bored, they're kind of obsessive compulsive. tendencies will turn inwards and they can become incredibly stressed or anxious. And so
Hmm.
you want to make sure that you always have stuff for your cats to do.
Yeah, yeah, that's particularly true for indoor only cats.
Yes,
And we can
exactly.
talk about that a little bit more too. Yeah,
Well, we
yeah.
should. So my next question was going to be, what are some effective ways to reduce stress in cats? So you give your answer and then I'll give my answer.
You know how I always go back to the American Association of Feline
Yes.
Practitioners because they are the experts. And so they actually have what they call the five pillars of the best cat environment or the best cat living situation. And so their first pillar is safe places, so that there are dedicated places for cats to go. You know, if it's a single cat, that there are multiple places that can be enclosed and that they can hide and feel safe in and that they know that they can get to easily. And obviously, with multi-cat households, sometimes those spaces are big enough for multi-cats if they like to hang out together, or individual for those cats that really like to get away from the others. The second pillar is having multiple and separate access to various important environmental things. So, multiple food bowls, water bowls, litter boxes, scratching places, places to rest. And that, so for a single cat, that would mean having more than one feeding station, having two ideally. So, the rule of thumb is always number of cats plus one. And
Yep.
so, in a one cat household, you would have two litter boxes that are separated from each other. You never want to have the food in the water bowl by the litter box because they hate that. Places where they can scratch, where they can sleep, and so that's important. Number three is opportunities to play, to hunt, to express that predatory behavior that they have, and so making sure that, for example, they're being fed in food puzzles, and we can certainly talk about food puzzles because that's a
Yes.
really fun one. But giving them that stimulation. So going back to that boredom issue. Number four is, which is so important, and back to the whole routine thing, positive, consistent, predictable interactions with their human companion. And so cats really, I mean, I think, and this is true for not just cats, but for dogs and humans and everybody. If you have a lot of anxiety, then being able to predict what's going to happen next really can help. Like if you don't know what's going to happen next, then that's really going to ramp up your anxiety. But if you have some ability to say, okay, this is, I know what's coming, then it's much easier. And that's definitely true for cats. The fifth one is making sure that your environment respects the cat's senses.
The olfactory thing. Yeah.
The olfactory thing,
Yes.
yeah. And so they specifically emphasize smell, which I think is really important. So cats
Yes.
have, their smell is like a thousand times stronger than human smell. And so they're very sensitive to candles. And I mean, how many freaking scented candles do you get for every gift? We have so many.
Ugh.
I never light them
No.
but they're just so popular right now. Cats don't like them, and any kind of perfume sprays they don't like. It's just too strong. So, making sure that you're using cleaners that are neutral in their smell. But to me, this also goes along with sounds. So making
Yes.
sure that there are not noises that are bothering them. That there's not bright flashing lights, bothering them. So just making sure that it's an environment that is friendly to a cat.
Agreed. And I would say also to that end, that not using bleach, because bleach, like to clean with, as I'm sure you know, bleach will actually keep them from being able to smell for a while
A
because it
little while.
kills. Yeah, it kills. What does it kill in their nose? I'm not a.
Their olfactory receptors.
Thank you. Doing so bad today. Wow.
The two of us together, we'll stitch this together.
Shout out to not eating and just being dumb. Yes, but bleach will actually kill your cat's ability to smell. And I think we would all be very stressed out if we suddenly lost one of our primary senses and didn't understand why. So definitely try not to clean with bleach in your home if you
I
can
have
avoid
to
it.
say the natural cleansers, and Martha Stewart has really good, I don't know if you ever have looked at her website, but she has really excellent recipes for just lemon, vinegar, baking soda, water. Obviously with cats and lemon, you have to be a little bit careful. You
Yeah,
have to really dilute that down. But all of those are natural cleaners, and I think easier on animal senses than some of
I'm
the commercial
sure.
stuff.
Do you
Yeah.
want to explain to people why they need to be careful with cats and lemon?
Cats just hate lemon.
Yeah. They just
In fact,
hate citrus fruit,
they
period.
hate the
Yeah.
citrus. Yeah, exactly. And for some, in some situations, you can use it to your benefit. So if you have a kitty cat that really loves electrical wires, then you can use like lemon scented deterrents.
Right.
You can spray the cords with something that's citrusy and they'll stay away from them.
Yeah.
But so then if you have all of those things in place and your cat is still depressed. So let's say a situation where another cat in the household has been lost, died, or something terrible has happened. And that cat is now, you can see, is grieving. Then how do you get that kitty cat out of that? I think the most important thing is being very compassionate and mindful that your cat is going through this and spending time, and I think that you have to be really thoughtful about the way you spend time with your animal. And so there are those that really take comfort in petting and snuggling and holding. And then there are those that don't, but will like your presence. And so being sensitive to that, sometimes it's just being close by. And I mean, it's just like with humans too. Sometimes just the presence of somebody else can be helpful. But then also, encouraging some activity with toys, seeing if you can get their interest with the fishing toys are one of the funnest things for cats. Anything that can get them up and active and moving around. Offering foods that they might not necessarily have had before. So making sure that, they're stimulated by what they're eating, doing food toys if you can get them up and about. I think being sensitive to all of that and not over pushing is important, but that's where you would start. And then, if it seems like things are just going on for a really long time and you're really not making a difference, to me, one of the most important things is making sure that they are eating. Yeah. And so if you're having issues with your cat not eating, I think we've talked about this before, if they don't eat, that's a big deal. Right. And so talking to your vet about potentially getting something like an appetite stimulant can be helpful so you can get them eating again. And then, those really worst case scenarios, if you feel like things are really not helping, you can certainly do medications and things like fluoxetine, which is generic Prozac, or gabapentin. Gabapentin can be hard because it can make them sleep a little bit more, but there are medications. And we can certainly backtrack and talk about some of the more homeopathic-y type of supplements and treatments, but that's kind of the progression, I would say. And I don't know, what's your opinion about it? Since you've had to live through this.
Yeah, so just for people who are listening who may not know, and I don't think there are any because I think everyone who listens to this is a Steve person, but we lost our head cat about a year ago, and then our vice president cat very recently, and it has really affected our cats, and they became very, very depressed, and in a few cases aggressive. And so at first I was like, I'm a behaviorist, I'm just going to help them through this with attention and novelty every day. And, as I recommend to my clients, bird feeders outside. So they have a natural stimulus to watch, and then little food puzzles. So they have something to complete the prey sequence, right? And making them enrichment boxes and playing with them more and giving them novel foods. And, I got them a running wheel and all this stuff that I could think of to do. And it still just wasn't, it was making a little dent, but it wasn't making enough of a dent. Which is when I talked to you, and we started a few of them on fluoxetine, which, as you said, is Prozac for cats. And I really sort of kicked myself that I hadn't done it earlier because it was so effective. It just helped kind of bring them below threshold so that the behavioral interventions were then effective. Right. So, because I think sometimes, especially when there's a loss or there's been a big change, your cats get so stressed, just as we do as people, that you're above threshold where nothing anybody says or does to help you is going to be helpful because you're above that stress threshold. So you need to be brought down below it so that interventions can be helpful.
Right. So it's interesting how similar all of this is to human anxiety. Don't you think? Like dealing with, yeah.
Absolutely. I always recommend to my clients who are going through this that they, depending on the severity of each case, right, that they add intellectual stimulation, they add environmental stimulation, they do things like the enrichment boxes and the food puzzles and the bird feeder and like all of that. But often, if the case is moderate to severe, that they go right to their vet and talk to them about psychopharmacological interventions. Which we can go into in just a minute. But first, I want to talk about another piece that does often come into play, which is those pheromone diffusers and sprays and collars.
Yep.
This podcast is not at all sponsored by anyone. But I will say that I only recommend the Feline brand of diffusers because they are the only ones that have clinical research behind them and peer-reviewed papers. I also only recommend the diffusers because I have not found, and the research has not found the sprays or the collars to be effective. And I think the collars can actually be a little bit aversive because cats can have a reaction. Yeah, like kind of like a dermatitis from having that like right against their skin. So, but I will say we have 5 of the diffusers going in our house all the time. We use the Optimum one, which is a combination of the bunting pheromone and the nursing mother's pheromone. And we notice immediately if one of those runs out, and we haven't like re-upped it quick enough, because the cats will start to kind of have issues around each other just in that area of the house. So while they alone will not be like a fix, there's never like one thing that you can do. It's always like putting a puzzle together and finding the right pieces. They can be very effective. So that's my take.
I agree. And I actually had my own little kitty cat, years ago, who she peed outside the box. And I always knew when my diffuser ran out because it would start again. It was kind of amazing. So it was, got to change that. So, I felt like it really worked too. For the sprays, we actually use the sprays on towels that we keep in the room. So we do in our exam rooms, not in my house. The hospital. So we have the diffusers in the cat rooms, but then we also spray the towels, and the recommendation is to spray towels before you put them in the carrier, before you bring your cats in too. So
that makes sense for like immediate use.
Yes, exactly.
On an object.
Kind of air those out a little bit.
Yes.
You don't want to put them in right after you spray because it can be kind of strong, but that's the way we use them.
That makes sense. When I was saying that they don't work, it doesn't work if I've had clients who are like, oh, I got the spray and I just spray it in the room. That's not going to be effective. What you're saying makes sense, to use it on a towel in a carrier or to use it on a towel in an exam situation. Don't buy the spray and just spray it around your room.
Exactly. That's going to help.
That's not going to do anything.
I don't know if you want to seg into any of the other, like, more homeopathic types of.
Yeah, we totally
I think somebody asked about like supplements, and so a supplement that's on the market now is, and again, no endorsements here, but so Purina makes something called Calming Care, which is a probiotic, and it's a specific bacteria that it works. It's the gut-brain connection, and so it works to actually increase serotonin in the gut that then affects the brain. And so they've done studies in dogs and cats, and it's just little packets that you put on the food. It's not something that's for immediate use. So again, back to our spray. It's something that you have to use. It takes about a month for that to get on board. And so it's something that you would use. Let's say you're going to move or something, and you're anticipating that there's a change, or you're about to go on vacation. Then that would be something that you could start ahead of time. Or if you're in a multi-cat household and there's stress, then something like that. There are also diets on the market now that have either L-theanine or L-tryptophan, which have been shown to actually boost, calming. I don't know what they actually boost, but they help with calming for cats. And so I think a lot of the like pills and Royal Canin have those diets. And then one last thing that I would recommend for somebody who doesn't want to jump to Prozac would be, there's something called Zilkine, which is a milk protein that also seems to have calming effects. So those are all kind of non-medicated supplements that you can use that may
What
help.
about CBD? I get a lot of clients asking about CBD, and I know you had recommended a particular type of CBD for pain. What do you think about CBD for management of anxiety and depression in cats?
I think that it can help with anxiety. I don't know if I would necessarily say for depression, depending on I don't think it's going to hurt. So that's what I would say. And so if you wanted to try it, and my recommendation is L-vet. That's the one that I typically recommend because they worked with Cornell doing their studies. And so it has what it says it has in it.
And that's ELLEVET. Yes.
Yeah. I don't know why they called it that. Female vet, L-vet.
Yeah, I know.
I don't know. Anyway, but and so they have their whole website. They have catnip flavored CBD, and it comes as paste. I think it comes as chews. It comes in different formulations to make it a little bit easier.
For cats, it comes as paste. It comes as an oil, and then it comes as pills that have the oil in
It's not
them.
a chew?
There's no chews for cats.
Oh, okay.
Yeah, the chews
So
are
those
just for dogs.
Okay.
So what types of medications are typically prescribed to cats with anxiety, and what are their potential side effects? I know you mentioned GABA. We already talked a little bit about the fluoxetine. Is there anything else that you would want to talk about, or have we hit everything?
No, there are other, the serotonin, the selective serotonin reuptake inhibitors. So paroxetine, Zoloft, which is sertraline, something like that. So there are other medications, which I feel like I always get pretty good results with the Prozac, so I don't typically use those. But there are a variety of other things. There's clomipramine. So there are, if a cat doesn't respond to one, just to let people know there are options for other types of medications that you can try. Those are the main longer acting antidepressants. And then there are medications like trazodone, which is more immediate acting. And then gabapentin, which is also more immediate acting, but both of those can cause sedation.
Right.
So I typically only recommend those for things like traveling or going to the vet or fireworks or somebody's visiting, those types of things.
Okay. And do any of them have like real side effects, especially the, SSRIs?
So it can affect appetite initially, can cause stomach upset. So some animals will have a little bit of GI upset that's temporary, and then the longer they're on it, they can get past that. I had one kitty cat who I always do blood work before starting and then again a month later, and the blood work was spotless at the beginning, and then a month later when we rechecked, one of the liver values went unbelievably high. So like 3,000 when the high end of normal is 100. Yeah. And so we ended up having to take that kitty cat off of the medication, and it was too bad because he really was doing well on it. So we ended up having to find something else. But so, sometimes there can be liver elevations. Some cats will just initially be a little bit more sleepy on it. So I've heard that a little bit. Nothing crazy. It's just a very, very small percentage of cats that people think they're not themselves on it, and so they'll stop it. But that's a very, very small percentage.
Okay. So how do you work with cat owners to identify and kind of manage specific stressors that their cats are going through?
That's a good question. I mean, really, it's about the history. So talking to them and finding out what's going on, but also just educating. So helping them to see from the cat's point of view. And I think that's often one of the issues that I end up dealing with as a vet, because I feel like there's this perception that, just cats are so easy. They take care of themselves. They're not a lot of work. When the truth is that they're very sensitive and they have very specific needs. And so a lot of the time it's actually educating clients about, this is what they're missing. These are the things that I would recommend changing, or whatever enrichment things. So, sometimes you have to do a lot of questioning and really digging in to find out what the issue is, because often clients may not know what the problem is because they don't recognize it as an issue for the cat. And so, I don't know if that's a good enough answer, but
I'm going to kick you off the podcast, Gina. That's it for you. You're the worst. So at what point do you kind of kick a case over to someone like me, who is a behaviorist? I don't even know my own job right now.
But behaviors, and I actually send a lot of people to you. I don't know how many of them actually end up calling you, but for me, because I have the appointment time is 30 minutes.
Yeah.
And we have to do a full history, a physical exam. We often do lab work. And so my time is limited. And so generally I try to take a thorough history, talk about options in terms of these are the things that you can do. Sometimes the case is just more complicated. So anytime there's any issues with aggression, I feel like that's really serious. And so that would be something that I would bump to you pretty quickly. Again, ruling out things like it's aggression because of pain or,
Yes.
something like that. And then also when it becomes a little bit more complicated because there are multiple cats and maybe the clients don't really understand what it means to have multiple cats and how they interact.
Right.
Because I feel like that's, and so talking about something like that takes a lot of time. So I send them your way.
Yeah. Yeah, that's totally fair. And that actually leads me into the first of our listener questions, which is how to handle cat stress when cats that have always gotten along suddenly have beef, right? And this is, I see so many intercat aggression in my practice, and that kind of comes just from what you said, that when you have a multi-cat household, you do have to put in a not insignificant amount of work to make sure that everybody has the right resources and a good amount of resources, like you already touched on. They need to have it separate areas for eating, for drinking, multiple stations, multiple toilets that aren't next to each other, toilets where they can't bully one another, right? Because a lot of cats, especially
So
if they get
important.
stressed, they will turn into toilet bulliers.
Yes.
So toilets that have exits, like multiple exits for them to get away from each other. They need to have intellectual stimulation, environmental stimulation, as we already talked about. But if there's a sudden beef, it's important to look for where's that coming from, right? Like, are they all of a sudden able to see a new animal? Is there a new cat wandering around that's perhaps unneutered or unspayed? And that will really rile up
Everybody.
and cats in the home. We've absolutely experienced that, and that's why a big part of why I've been on this like TNR kick in our neighborhood, because our guys will just start peeing on everything, and also to obviously help the cats, but because we can only throw out so many couches before
Right.
comes a real hit financially. But I think getting to the root of the problem, especially by collecting data, I always like to have people, if they can't install cameras or they don't want to install cameras, at least start keeping a logbook of when incidents happen, the day, the time, where it was, what was happening right before, what happened right after, so we can start to see, is there a through line, like what is linking these incidents together, and then we can start working on a plan of attack, and then certainly adding in more things for the cats so that they're more occupied in their brains and they have less times to worry about each other, and we may even need to do separation and reintroduction. But getting to the root of the problem is the biggest.
I think the camera idea is it is so easy to get a camera these days. And recently I had somebody who came in with his cat who is, oh my God, beautiful Bengal, that was pooping outside the litter box. And thank God he had video to show me. And it was interesting because to me it was really obvious, even though he had been watching this video, he knew it wasn't obvious to him. They had this really lovely designer litter box it was very beautiful. But from the video, it was just really clear. The cat would go in and he would pee and there was not enough room for him to poop. Yeah. And so then he would go outside of the box and he would poop, and then he would cover up the poop, he would pretend he was covering up the poop and walk away. It was just, and from watching him in this little narrow litter box, it was just so obvious to me what was going on. And so having that video saved a huge amount of time.
Of course.
They need a new box. Yeah.
And as you know, I'm a big proponent of cameras all over the place. Yeah, we've got them at cat level all over the house.
If people don't want to have cameras all the time, at least for figuring out what's going on, just for the temporary, it really makes a big difference. And so, we get a lot of video of things like, is this a cough or is this a gag? Because sometimes that can be hard to determine. So I really encourage people to take advantage of that technology.
I agree. And I know I've sent you video of, is this a cough or is this a gag? 100%. You've gotten those from me. You've gotten a lot of annoying videos from me. Sorry, I'm the worst. Another question is, how do you reduce stress for a sensitive cat in a multi-cat household? And I think we've already given a lot of strategies to answer this question. I would say definitely install those Feline diffusers if you can. I would, again, go with the optimum, because then you're getting both pheromones. You're getting the bunting pheromone and you're getting the nursing mother's pheromone. And those are just saying like, hey, this is my territory, I'm comfortable here, and we're all family and we all get along. So you might as well get more bang for your buck. And then adding in additional playtime. If you want to do clicker training, if you want to try doing harness training and taking people out for a walk, especially if that sensitive cat, our most sensitive cat, Kitten Man, as you know, Gina. He is harness trained, and when he starts getting, oh, he's right here. Starts getting a little punchy. We make sure to take him out for extra walks because movement is really helpful.
So important.
Exercise is helpful. And I think also when you're in a multi-cat household, they all tend to want some alone time with you.
Yeah,
and so it's important
absolutely.
to build that in. So just look out for that sensitive cat's
what it is
needs,
that they,
what it is that they need, and give it to them in an extra way so that you can reduce that stress.
Yeah, absolutely.
Somebody else wants to know, how do I know if my cat is depressed and if he needs a cat friend? And I think we already covered the how do you know if your cat is depressed part. Do you have any thoughts about
on the cat
cat friend?
Yeah.
Yes.
My philosophy about cat friends, for single cat households, adding them in, it's a little bit like getting a roommate for a human. Because unlike, where I feel like if you're a dog-friendly dog, it's pretty easy to get another dog in the house and usually it's going to be okay. But with cats, that's not necessarily true. It can go either way. And so if somebody just brought in a roommate for you, are you going to necessarily like them? Maybe not. And the same is true for your cat. And so for one thing, you have to know what their personality is. My experience, and I don't know if you necessarily agree with this, but I feel like the younger male cats tend to be more open to having new cats introduced. And the younger in general a cat is, they tend to be much more open to it. Older female cats, forget it.
No,
they do not want a roommate. They don't want a roommate. They don't need new friends. They have their friends. They're fine.
Yeah.
And so that's generally, if somebody has an older cat and they're like, oh, she needs a friend, I usually say no.
No, absolutely.
She doesn't want a friend.
I am right there with you. And in fact, all you're going to do is antagonize that older female cat and possibly give them, urinary problems or, I always tell clients, it's
that's
like,
exactly right.
If you tried to move a toddler into a house or a teen into a house with a grandma, this is not a roommate situation that would work well. And the grandma just wants to watch her stories and go to sleep at 5 p.m. And the teen is like, rah! Like, it's such a bad combo.
Absolutely.
I've seen it so many times. Such a bad combo.
It is. Yeah. It's such a bad combo. Yeah.
Someone else wanted to know how to ease moving houses with a single cat to prevent stress, depression, etc. Do you have any tips?
That's a really hard one because moving is so stressful. Having moved many times in my life, and it's stressful for the humans as well as for the animals. So, I don't know. I have to say, the things that we were talking about. So maybe starting ahead of time by having your diffusers, doing something like the Zilkine or the calming care, or getting a diet that has L-tryptophan or L-theanine in it, those, just kind of starting from there, like as a baseline, get those things on board. And then, as far as the packing and all of that goes, I guess making sure that there's always a spot that your cat can go to and take care of themselves, where they can hide, where they feel safe, where they're comfortable. And that's got to be the last thing that you attend to. And so trying to do the things that are farthest away from that, kind of packing your way around to the very end. And ideally what you would do, if you plan well enough, is you can then get things moved over to the new place and get your kitty cat all established before getting things, I don't know. That would be my strategy, I think.
No, that's a good strategy. And I can say, because we just did this 2 years ago, what we did was, we closed on this new place. I came here, just plugged in Feely all over the house, but especially in the bedroom and my office, which are connected, and which was going to be the holding area. So I like to recommend that people have holding areas in their old home and in their new home, so that you don't lose a cat while you're moving, or, while you're moving into your new home or moving out of your old home. That is a very high stress situation, and cats bolt often. So absolutely hold them in an area, especially if you have movers coming and they're moving stuff in and out. And even sometimes when you're packing, I have absolutely heard stories of cats who jump in boxes and get packed up. So that was a huge fear of mine. So we kept the cats in one area while we packed, and then let them out at night once all the boxes were shut. And
Did you hear about the cat that got mailed?
Yeah.
Yeah.
It gets so crazy. I was so terrified. Or I've heard of cats like burrowing into couches and then you never see them again. Like, it just is terrifying. So keep your cats where you know that they cannot run or get
Go.
packed, right?
Yep, right.
We moved them up here ahead of time. There was a built-in bed, so that was like already here. And then we had the movers come, pack up the rest of our stuff, pick up the stuff. I gave the cats trazodone the night before, the morning of. They're all carrier trained, so that was pretty easy. We just opened the carriers and they just went in. The morning of, we hired a cat moving service who they came because we have 10 cats, right? So it's a big ordeal. It's not like one cat or two cats. There's 10 cats.
Yeah.
So they came, they had a big special van where everyone was like belted in their carriers. They drove us up to our new house and I unloaded them, put them all in the bedroom, which was saturated with Feline. Unbeknownst to me, they found a hole and were able to get into the built-in bed. So they all like jumped out. And then I came back like 20 minutes later and I was like, where's all the cats? And then they were all in the built-in bed.
Yeah.
But then they came out and I had brought things from home, like their scratchers and things that smelled like them. So then the movers came later that day. The movers did not move anything into that part of the house. They just brought everything and we moved it later. And then once they were comfortable after a few days in this area, I gradually let them out. I let Steve out first because he's the head of the house, so he could walk around, put his smell on everything. Once he was confident, which, he was always confident.
Took no time.
He was
I know,
just like,
exactly.
oh, awesome.
He owns every place.
Yeah, he did. He thought he owned every house he ever saw. So he was just like, cool, this is all mine. Once he put his smell on everything, I let everyone else out, and then they were all happy. But it was definitely a process. And I think making sure that the cats are safe in areas where there's going to be a lot of noise, banging, unfamiliar people and sounds is the most important piece. And then also the medication part.
I was going to say the trazodone is definitely makes a lot of sense.
Yeah, there was not a peep on the 2.5 hour drive. Everyone was just like, woo, this is great.
Ooh, this is so nice. Yeah.
No problem. And then they're so happy up here. It's great. They're so happy.
Well, they've got such great entertainment.
They do, but it was also just such a good transition because it was I was so crazy planning it that it went very smoothly, and because we still had Steve who could just walk everyone through it and be like, "Welcome, everyone,
we're good,
amazing." Yeah, so I think all that stuff was really, really helpful.
Yeah.
Oh, someone else asked, are my cats fighting because they're picking up on my stress? My answer would be, I doubt they're fighting.
Maybe,
but cats absolutely are picking up on your stress. I'm sure they can see that your body movements are different. They can probably smell a change in you. So that might trigger them, have additional anxiety. Would they fight solely because of your stress? I don't know. And I certainly wouldn't want you to go into a place of blame. But I would think externally, are you doing less interacting with them because you're stressed? Are there other things that are happening because you're stressed?
Has it disrupted the schedule?
Exactly.
Yep. Yeah.
That kind of stuff. Yeah. Has their schedule changed? Are you not playing with them as much? Are you not snuggling with them as much? Is one cat getting more attention than the other cat? And is that causing them to fight? Is that kind of a trickle down of your stress? Or is just you're coming and going unpredictable now? That kind of stuff. That's where I would go with that.
Right. I agree. That would be what I would say. Yeah.
Yeah. Someone else asked, is it better to have a shorter drive for a closer vet or a longer one for a fear-free vet?
I guess it depends on how your cat does in the car. I think I don't know. I guess it depends on a lot of things. If the closer vet is rough and, doesn't do well with cats, then I would say go with the longer ride for your fear-free. But, I think there are just so many factors. If your cat hates the carrier, hates being in the car, everything is horrible, then I would say it makes sense to pre-medicate them before they go. In which case, if you're going to pre-medicate them, then go to the doctor that you work the best with and that works the best with your cats. And that's not always a fear-free place.
Right.
So I think you just have to have a good relationship with your vet. And if it turns out that's the closer one, then great. But this is a good situation for pre-medications.
Absolutely. And on that same kind of track, is it okay to ask a non-fear-free practice with a vet that you love to make accommodations?
Absolutely. It never hurts to ask. And especially if it's a vet that you love, then my assumption would be that you love them because they're open to working with you,
Right.
and that they're reasonable and that they love your pet. So
Yeah.
I would imagine that they would be very open to whatever suggestions you have.
Yeah. Somebody else asked, how can I desensitize my cats to the car? You go
That's a
ahead and
good
then I can jump in.
question.
Yeah.
Yeah. Well, so from my point of view, one of the things that can be a problem for cats is that they can get car sick.
Mm-hmm.
And so make sure that you talk to your veterinarian about motion sickness medications that you can give ahead of time. And if it's super stressful, then again, trazodone is amazing. And so giving those
Mm-hmm.
medications, I think getting them used to the carrier, which is something you and I always talk about, making sure that
Yes.
that's not, you're not putting them in a carrier for the first time and then they're immediately getting in a car. That's just incredibly crazy. So just make sure that that's a place that feels safe to them. And again, we go back to our Feel Away spray
Mm-hmm.
on those towels and put those in there and get that all cozy. Ideally, I think this is the hard part, ideally going for drives that are short
Yes.
initially, seeing how your kitty cat does, and then, building up from there. Hopefully you're not going from New York to California and that's the first time your
Yeah.
cat's
Yeah.
been in a car. But yeah. So, slowly but surely and using all the tools that you can.
I agree. And I just gonna add, I feel like I say this on every episode, but like carrier training, I'm the biggest proponent of carrier
Yep.
training.
Same.
Your cats should think that their carriers are like their fun little forts,
Yep.
which,
Exactly.
like I said in my moving example, for most of our cats, not the two that are still pretty feral, and we do have to, unfortunately, like catch and put into
Mm-hmm.
bags. But most of them, if we just put a carrier on the ground, it is a competition of who can get in
Uh-huh.
the
Who's going to get
carrier.
in first?
Right. And then
Uh-huh.
we have to be like, no, not you this time, and it becomes like a thing of like who's actually needing to go to the appointment. So they should really view them as like a fun place that they
Mm-hmm.
get to go in. We all know that if you open a can, right, cats are very
Mm-hmm.
used to sounds. They know the
Yep.
sound of something and they make an association with it. So if you
Mm-hmm.
open a can, a cat will come to the kitchen and be like, ooh, what am I getting? Where's my snack, right?
Uh-huh.
By that same token, they have an association with, if it's not frequent, the sound of a carrier or the
Mm-hmm.
visual of a carrier and something
Yep.
bad coming with that.
They're
So
not stupid.
yeah, so
Yeah.
they're going to run and hide the second they start to hear that. And then you're going to continue making this behavioral loop tighter and tighter
Mm-hmm.
of something that is
Mm-hmm.
fear based and bad with that carrier. So you want to start out, just leave the carrier open, fill it with toys and treats and things that are nice. Leave that carrier open or out all the time if you
All the
can.
time. It's part of furniture. Yep.
If you have multiple cats, just leave one out or two out. You don't have to leave
Mm-hmm.
10 out like in our house. That would be crazy,
Uh-huh.
right? Like we're
Insane.
not going to
Yeah.
leave 10 out unless it's the night before we're moving, in which case we did. And they were like, wow, this is a great party. Like, this is so fun. And they were just all in and out of each other's carriers, even though they were high on trazodone, which actually kind of made it funnier. But just really work on that. And then, like you said, work on now, then you're picking up the carrier. Now you're putting the carrier into the car. Now, and each time with like tiny little changes. Now you're going on a
Mm-hmm.
5-minute drive. Now you're going on a 10-minute drive. Now you're going on a 15-minute drive, right? Like it can take time, but it's really worth it so that when it's time to go to the doctor, you're not having to go like
Mm-hmm.
start 2 hours in advance chasing your cat around. And
Mm-hmm.
now your cat is really afraid of the car and the carrier and the vet.
Yep. You would be shocked by how many appointments get missed because the cat wouldn't go in the carrier.
I'm not shocked at
It's
all.
just
Yeah.
it's all the time, and
Yeah.
it's a bummer for everybody.
Yeah. I mean, we have had that problem with our feral cats because I don't want to continue that loop with chasing them.
Yep. Yep.
Right? Because then
Exactly.
you
Or
just didn't.
coming in and they're all slashed up because
Yeah.
that's
Yeah.
no fun either.
It's
Yeah.
not. But just so that listeners know, if you can't get them in the first few minutes, my feeling is that you should stop and
Mm-hmm.
just reschedule that appointment if you have an understanding vet. Otherwise, you're just further terrorizing this cat so that the next time you try, it's going to be even harder. And then the next time it's going to be even harder. And then you're just tightening
Yeah.
the noose.
Which is why it's so important to do it well before you
Yes.
have to go. So
Yes.
yep.
Yeah. Somebody said, what are your thoughts about choice-based meals for picky eaters with stressed guardians?
A buffet, like putting out as many different foods and letting them choose. I'm all for
Maybe.
it. I would
Yeah.
say do it and then find out what they like. And you
Okay.
have, I feel like there are always two flavors of cats. There is the cat that will only eat the same thing every single day and never wants it to change.
Mm-hmm.
Or there's the cat that loves that can the first day and then the second day
Yeah.
they hate it. And so you have to change it every single time.
Yes.
And so figure out which one yours is. And then, rotate if they hate it the next day and keep it the same if they want it to be the same every day.
So the question is, how can I reduce stress in my cats when I work from home and I can't always stop when they ask? So I would just add more, again, intellectual stimulation, toys, things that they can do on their own. If you can, put up a bird feeder, put out a lot of food puzzles. We didn't actually really talk about food puzzles, but food puzzles are a great thing for cats to be able to work for their own food. I'm a huge proponent of if you give your cats dry food, only putting it in food puzzles so they really have to work for every little piece of kibble. And that's really helpful for giving them something to do, alleviating boredom and stress.
There's a website, foodpuzzlesforcats.com.
Ooh.
So go to that because that will give you ideas on, you can just make your own food puzzles. You don't have to spend money.
You don't.
So go to that website.
That's very helpful. Yeah, you can make them out of like a toilet paper tube.
Absolutely. Yeah, absolutely. You can stack them together. You can use egg carts or egg crates. What are they called?
Yeah.
Egg crates.
Egg crates.
Yeah. So there's just
cartons.
a ton. Cartons. That's where the cart came from. Egg carts. They're not egg carts. Egg cartons. Yes.
Yeah. Between the two of us, we've got half a brain.
We're getting there.
Yeah.
But yeah, so definitely food puzzles. But also I think that an important component of that is the routine thing.
Yes.
So getting them to understand, this is playtime. And so maybe you schedule playtime right before you have to work, and then making sure, especially if you're at home and you have the opportunity to do a midday, this is playtime, and just making it like really regimented, because they really, their internal clocks are so good. And so if you can develop a schedule that they can predict, then that's going to be the easiest for them.
Agreed. And then also rewarding them when they are doing behavior that you like, right? And then ignoring when they're doing a behavior that you do not want, right? So that also goes a long way into kind of helping to train them in this initial period that they should not bother you, even though they're not bothering you, but they shouldn't bother you while you're working. And then they get a reward if they don't. You can like throw them a treat every once in a while.
And no water sprayers.
Oh yes, absolutely not. Aversives do not work on cats. They really don't work on any
it just
animals.
Freaks them out.
Yes.
Yeah.
But it can go too far the other way, and it can actually reinforce behavior that you don't want, especially if they're doing it because they're attention seeking. So sometimes or actually more likely than not, even though they don't like being sprayed, they still see it as attention from you, right? Because you're spraying them. And so it will actually just reinforce that behavior that you don't want, because their highest value item is your attention. So, or you can have a cat like Steve, who would just be like, amazing.
It's a party.
Thank you. Thank you for this fine mist. Like, I knew anything about cat behavior before this was my job. And when Steve was young and he was extremely naughty, I tried, because that's out there in the lore, is like, use a spray bottle. And I tried that, and he did not care at all.
Early in my career, I recommended that. That was the thing. Yeah.
We all make a mistake. And that man did not care. I sprayed him right in his face, and he was just like, woo, thank you. It's refreshing. Love it. Did not care. And so I was like, well, this is dumb. And it doesn't, no aversives work. So you want to always,
don't do aversives.
Ignore
We're moving
behavior.
away from that.
No aversives. Don't yell at your cat. Don't spray them. Like,
don't
none
clap
of that.
at them.
Because you're just reinforcing behavior. So ignore what you don't like, which can be absolutely very difficult. I'm not perfect at it. Sometimes I'm still like, no. And then I'm like, I'm just, in the heat of the moment.
Nobody's perfect, like you said. But
ignoring
recognizing that that's not helpful can be helpful.
Exactly. All right. Well, thank you so much, Dr. Rendon, for appearing on this very muddled brain on my behalf episode of Hiss and Tell, where hopefully people learn something. I'm sure from you. I doubt
there are
from
some
me,
nuggets here and there. No, I absolutely.
But thank you, as always, for being on the podcast and for sharing your vast wealth of knowledge with all of us. We so appreciate you.
Always so fun.
And for anybody looking for the world's most amazing vet, if you're in the Brooklyn area, make an appointment with Dr. Gina Rendon at Williamsburg Vets. And that's my plug for you.
Thank you.
All right. Thank you again. Thanks for listening. As always, if you enjoyed the podcast, please go ahead and give us a rating and or a review. We'd super appreciate it. You can find our social medias, Instagram and TikTok at Hiss and Tell Podcast. For cat behavior consultations, go to catitude-adjustment.com. Music provided by Cat Beats.